For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hi everybody, and thank you for joining us. I'm Larry Little, Public Information Officer here at the Emergency Operations Center.
Hi everyone, my name is Betty Young. I am the Deputy Public Information Officer here at the Emergency Operations Center.
And Betty, today we're going to just spend some time talking about information and resources that have been available to the community as we navigate through COVID-19. And I think the perfect place to start is talking about why we remove our facial coverings.
Yes, absolutely. So we removed our facial coverings prior to filming the segment to allow our American Sign Language interpreters the ability to read and see what we're saying to properly interpret for this segment.
And that's one of the resources we have provided here at the county, is providing ASL services when we decided to do Facebook Live, because our deaf community is very important to us, and we wanted to include everyone in on this conversation and information as COVID-19 continues to evolve in the community. So we're very thankful to have our ASL staff here. I'll tell a very quick story. In speaking with Kelly, one of our ASL interpreters, she said something that stuck with me. She said for a lot of people who are deaf, sign language is their first language. So I'm so thankful that we are making sign language available here on some of our programming.
Absolutely.
And you have the numbers from our data dashboard.
I do. So, ladies and gentlemen, as of today, we have 21 new cases, bringing the case total in Santa Clara County to 2,381. We have 2 new deaths, bringing our total to 132 losses. Our condolences and well wishes are with the loved ones and family of those we have lost.
Absolutely. And Betty, the data dashboard is a wonderful resource we have available here at the county where you can stay in the know on COVID-19 as it relates to Santa Clara County. The information is right at your fingertips. There was a comment last week, yes, I do go and read the comments, where someone said, I want to see Dr. Cody out here giving the numbers and the updates. Well, now you don't have to wait on Dr. Cody. You have the access to the data dashboard at your fingertips, and that information is updated daily.
We have a team of epidemiologists, operations and logistics staff persons, and data scientists, making sure that these dashboards are updated daily.
And also another resource we have, testing centers. Testing centers, 2 of them are now open in Santa Clara County. One testing site is at James Lick High School in East San Jose, and one is at Christopher High School in Gilroy. Testing centers are by appointment only. You can schedule an appointment by visiting sccgov.org/coronavirus. And you're going to hear us say that a lot of times today, because you can find all of the information that you need at sccgov.org/coronavirus. The screening and testing criteria are based on the state guidelines and may be updated to reflect the latest information. These new sites are open from 7 a.m. to 7 p.m. Monday through Friday, and each site has a capacity to serve up to 132 people daily. So that's exciting. Also, did you know we have, COVID-19 has changed everything as we know it. So it has created a lot of questions for the community. So we have an on-site call center where people can actually call in to 211 and ask questions. You can ask your questions. Our call center staff are on standby, ready to answer your questions relating to resources, the latest updates involved with the current shelter-in-place order, also with any questions you have around clarity, clarification of certain portions of the order. Our call center staff they are able to respond to calls and questions in up to 40 languages. So we really hope people take advantage of this resource. And we really have the best team who care deeply about being able to connect our public, our residents with vital information. Absolutely. And not only do we have 211 available as a resource, we have a FAQ team here answering all your questions. I spoke with them this morning. So far, they have answered 5,200 questions from community members. So that's great. And if you have a question about something, you can probably find it on our website, secgov.org/coronavirus, and use the quick links to ask a question or find an answer to a question that has already been asked by a community member.
Absolutely. So the FAQ team, we actually have a team of live people who are public health specialists and also Department of Environmental Health, health inspectors who are staffing this FAQ. Staffing the FAQ team, and what they do is that they go over every single question. They're very thoughtful about their answers. For questions that we don't have a readily available answer to, what they do is that they then consult with the public health department, with the branches, to make sure that we arrive at the right answer for those who are sending in the questions. Now, if you go to our website, you do have the option of choosing one of 5 languages to receive information. These are complete reconstructions in different languages of our public health website, which means you could submit your question through the FAQ interface, online interface, in English, Spanish, Vietnamese, Chinese, and Tagalog.
Wow, amazing.
Thank you.
And we realize that everyone is not on social media. You don't have a Facebook, you don't have Instagram, you don't have Twitter. So we have a newsletter here at Public Health, and you can go to secgov.org. I told you I was going to be saying that a lot of times, /coronavirus, and sign up for that newsletter. That way you can stay up to you can get the latest COVID-19 information right in your inbox. Right
in your inbox. And these newsletters are also being sent out in Vietnamese and Spanish. We're working on expanding our language capacity. The great thing about these newsletters is that we have a language access team, a very large team of people who care deeply about language accessibility, who have lived experience themselves. For example, I remember my first experiences with the county in elementary school, coming here to translate for my mother and father. So this is something that's very deeply personal to me. So I'm very proud to be a part of the efforts now to expand our language accessibility. So with these newsletters can be issued in multiple languages. Go to the website. You can also submit an email to covid19@eoc.seccgov.org in your language of choice and let them know you want to be on the distribution list for Spanish or Vietnamese.
And Betty, so I was driving down Monterey the other day, and let me tell you, it wasn't an essential trip. And I looked up and I saw a billboard with very familiar faces.
Oh yes. We are during this time of unprecedented need and crisis. We are asking a lot of our county staff persons. They are doing double, triple, quadruple duty. Sometimes in areas that they never expected to do. So some of the folks out there may have seen some public health County of Santa Clara billboards, recognizing that there is a digital divide, a very significant one, in certain communities and certain areas among certain populations within our county. We are trying to employ every single communication channel that is available out there, including billboards, which goes back to the basics. So these billboards, the models on the billboards are actually our own county employees. So we've gotten a lot of great feedback about seeing familiar faces. We really want to put that out there, that the diversity of this county is one of our great strengths, and it's here at the organization too. We have people who are culturally competent, who practice language accessibility in their daily lives, both personal and professional, and they are now, who better than they to be the ambassadors of our messaging in our communities.
So lots of great information on resources and information that we have available as we navigate through COVID-19. And if you didn't hear anything we said today, you can go to secgov.org/coronavirus and use the search tool and find anything you need, information on anything that you need. It's right there.
Yes, it's a very expansive website with multiple pages and multiple links. So, in addition to that, and in addition to updating and being very comprehensive in our information on our website, we are also trying, we also put a lot of effort based on your feedback. So I want to really thank the public. Your comments, your feedback, your emails, and how we're doing has really affected how we communicate these changes in the messaging around this crisis. So it informs how we could better communicate.
And one more thing, I talked about people not having social media before. So those of you who are watching, please share this information with community members who are not on social media, or maybe they don't have access to the internet.
Right.
We depend on community-based organizations, religious organizations, and community leaders to actually get information out and share it and let them know that the county is here to help.
Right, help us amplify our message. So I know, in this really extremely diverse county of ours, being one of the most diverse in the country, right? Whether you speak another language or not, I know that you have neighbors, you have friends, loved ones, co-workers, colleagues who may fall into the categories of limited English proficiency. Please let them know, please bring it to their attention, help us amplify that message that we have made significant, deep investments into language accessibility, making sure that everybody is able to receive our message in a way that's culturally competent and relevant to them. And we're going to continue applying our best efforts informed by your feedback. Thank you.
And Betty, I want to tell the public, thank you so much for sheltering in place. I know it's not easy, and I'm not even going to go down that road, because if I could talk about all the ways it's affected me, I would be balled up like a baby crying on the floor. So we're going to end on a lighter note as we get ready to leave today. So what's the least important thing that you want to do when all of this is over, or the regulations are relaxed a little bit? The least important.
The least important thing. It's one thing that this COVID crisis has made very clear to me is that I guess there's no such thing as least important things anymore. All the little treats and all the little things that you used to do in the past prior to COVID mean so much and are so critical to all of our well-being now. So I just cannot wait to see my family and friends again, practicing proper hygiene practices to make sure we protect our health and others. But I just want to see my friends again.
Me too, but I also want to go to TJ Maxx.
Oh my goodness! Yes, let me come with you.
Absolutely. All right, that's going to do it for today. Thank you for watching, everybody. Stay safe, and thank you so much for sheltering in place, and we will see you next time.
Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.